Well, COVID-19 infections remain a cause for concern within the country. However, it's not had a severe impact on children. South African children are not yet eligible for the vaccine. But with primary schools now resuming today, can we let our guard down? Let's chat now to Dr. Tendesayi Kufa-Chakeza, an epidemiologist, as well as public health specialist who joins us this morning. Doc, a very warm good morning to you, and thank you so much for your time. I think what your surveillance data is showing at the moment is that young children are not the drivers of the COVID-19 pandemic. Let's get clarity on this and ask, why is this so? What serves this notion?
Thank you so much, Tumela, for inviting me. So just to clarify or to get on from your question, children have not been driving this pandemic either in South Africa or elsewhere in the world. And the reasons for this are many, but there are two main ones. The first one is that it's biological, that children have fewer receptors for the virus. So as we know now from the science and all the research that has been happening since the COVID-19 pandemic started, that the virus needs a receptor called the SARS-CoV-2 receptor or the S2 receptor. So that receptor is less dense, or there are fewer of those receptors in children's respiratory systems. And the number of those receptors then increase with age. So you find that the younger the children are, the less likely they are to acquire COVID when they are exposed to it. But having said that, we know that children of all ages, from babies to older teens and adolescents, can get COVID and have gotten COVID even here in South Africa.
Yeah. Would that
and
be
the other reason, of course,
yes.
Yes?
You may continue, Doc. Finish your point.
I was going to say that the other reason is that the immune system in children is still developing. And so part of the reason why adults battle so much with COVID is our own body's response to the virus. So we tend to overreact to the virus. Some people do. And in the body's attempt to get rid of the virus, it then causes more problems for the body. So, but in children, their immune systems are still immature and developing, and so they don't have the same tendency to overreact. So you find that when children get COVID, they may have COVID sitting in their respiratory tract. They may have viral loads that are as high as in adults sometimes, but their symptoms tend to be milder. Yeah. And they're much less likely to get severe disease. And that also tendency to get less severe disease decreases with age. So in other words, as children get older, they're also more likely to get more severe disease because their immune systems are also maturing and matching that of adults.
Right. With that being said, Doc, I wanted to follow up with this. We know that the country right now is going through a vaccination drive, but targeting the older age group. Is it likely that in future we can expect the younger children that we're talking about now to be part of this vaccination program or not?
Yes, we will expect that children will be vaccinated in time because they also get affected, but to a much lesser extent than in children. As we've seen in our surveillance data so far, children make up 10% of COVID-19 cases in this country when they make up a third of the population. So when we talk about children, we're talking about those that are 19 years and younger. So that shows you that they're disproportionately less affected. So if they were affected at the same level as adults, would expect that they would also make up about a third of the cases, but they don't. They make up much less than that. But having said that, there are groups of children that are affected more than other children. So children with underlying conditions and older adolescents, children that are 15 to 19 years old in our own data. Especially at the beginning of the third wave, we saw quite high rates in children that were 15 to 19 years old, and that has been coming down as well as the adult disease cases were also coming down. So in other countries have started vaccinating children that are older than 12 years. The Pfizer vaccine has received emergency use authorization by the FDA for use in children 12 to 16, because before they were just vaccinating year olds and above, but now they've moved down to 12-year-olds. So we think that also as we get more and more vaccines available, right, we will also vaccinate children. But my understanding is that we've extended vaccination to people of all ages with underlying conditions, but we do need to clarify whether that includes children as well.
All right. Doc, with the few seconds that I have left with you, please try to be as brief as you can as you answer this question. We know that, young children who are of primary school age, are going back to school today. Actually, I think by now they've probably commenced with their classes. There is concern from parents and, perhaps even the overall South African community in terms of making sure that they keep safe. How would you advise that all stakeholders, whether it's parents, communities, schools, ensure the safety of these children at home, rather at school, because they're going back to school? These are the primary school age-going children.
Yes. So although our data shows that these are the children that are at lowest risk compared to adults and older adolescents and teens, they are still at risk. We still get children in that age getting COVID. So there is every need to be cautious. There's every need to keep our guards down. So masking always, proper ventilation in the schools, sanitization of hands as the children are going in, maintaining social distance, avoiding large gatherings. Having said that, we know that the school setting itself might put a lot of children in the same place, but I know that the Department of Basic Education has been working with schools to make sure that children are sitting at least 1 meter, 1.5 meters apart where that is possible, but mask on all the time. And at home, we minimize gatherings, because where school outbreaks have happened, most of the time it's the children bringing the virus to school from the community. And as community transmission increases, we also see a lot of not an increase in transmission in school. Right. So what happens in the school is what is happening outside. So when our children are going to school during the weekends, we avoid gatherings, we avoid unnecessary contact with other people, and we carry on like that. But we do need to keep our guards up and to be vigilant all the time, and to make sure our children understand that mask has to stay on for as long as possible.
All right, Doc, that's where we leave a conversation. Thank you so much for joining us, Dr. Tendesayi Kufa-Chakeza, joining us then, epidemiologist from this university. Just talking about the importance of, young pupils, primary school going age, keeping safe, and also making sure that as communities we keep making sure that they're safe and we do continue to educate them around COVID-19.